Hello, my name is Keith Efford. I'm the Senior Product Marketing Manager with Nidek. I'll show you some benefits of the Nidek YLC-500 VIXI yellow laser. It's true 577 nanometer laser for treatment of macular disorders such as panretinal photocoagulation for diabetic retinopathy, retinal tears, macular edema, and also retinal vein occlusions. But some of the benefits of the YLC-500 VIXI laser is that it has 22 scan patterns. We have an auto forward function, and we also have an optical design that is safer for the cornea. The YLC-500 VIXI has 22 pre-programmed scan patterns to allow treatment of varying retinal pathologies. By selecting on the touchscreen pad, we have a single shot, we have square, we have equal space. We can also select from rectangles, triple arc or triple curve, circle, triangles, and arcs. By selecting one of the scan patterns, we can utilize our auto forward mode. And this is a nice benefit because we can treat 2 down to the left and up, 3 down to the left and up, 2 down, 3 down, or 2 down to the right and up, and 3 down to the right and up. And this allows the doctor to be able to concentrate on not adjusting the focus, but allowing him to treat properly. In addition to our auto forward mode and our 22 scan patterns, we are now offering LPM. This is our low power mode, which is minimally invasive photocoagulation. So it's a form of photocoagulation that delivers reduced power to the retina for a therapeutic effect. During treatment, the standard yellow laser power is decreased by a specified ratio, and a software upgrade is required to use our LPM option. So in summary, the Nidek YLC-500 VIXI offers many features that are going to help doctors treat their patients effectively with efficiency. Thank you.